till up to 8 years down the line in some cases, and so hopefully the economy will have been better by that point if Obama focuses on jobs as he should in the next few months.
But it's based on people's expectations, though, because they know today that they're going to have to pay more taxes later in the future. And other countries are going to look at America and say, okay, well, their deficit is not, going to go down. I mean, or, they're taking on this big legislative agenda, which is going to cost $940 billion. It's already built into their expectations that we're going to have to pay for this somehow. So although it might not hit our pocketbooks until 2014 and maybe 2018, it still changes the way people view America. It still changes the way people consume right now.
And also,
it's also built into the expectations of the American people and of our government. We've taken on this big new legislation, and even before we did that, we had a massive deficit. So we're going to have much more trouble enacting any sort of meaningful legislation. I'm sure climate change is dead for at least another year. It's not going to be talked about.
Well, I mean, I guess this is me getting polemical again, but if people have to take up a serious issue with a $940 billion bill that gives health care to people, but we're not getting up in arms about being bogged down in two wars that just don't make sense anymore, that's cost way more, and has cost way more lives, and has damaged our image abroad, and the ramifications have been far worse than well, then that's a good. I think to me that shows that democracy maybe is not always the best answer. I mean, if people are getting this up in arms about a social issue that's giving people health care, and we're not getting up in arms about killing people, and because you look at the defense budget in this country, it's obviously it's
way bloated.
It's way bloated.
And just to add to your point, I mean, nobody was up in arms over giving tax base to the wealthiest 2% of Americans, which has cost us way more than this bill will cost. There's some distortion of our priorities.
But on the other side, to be fair, that is a proven method of helping the economy. President Kennedy engaged in supply-side economics to boost the economy in the 1960s. I mean, it works, and I think it's kind of
for the past 3 decades or so. I mean, I would say it's improving that it hasn't worked.
Yeah, I mean just fair discussion.
It works on net GDP increase, not necessarily things like income inequality that this healthcare legislation is meant to address.
I mean, this legislation addresses the other America that we don't live in, and so when you make a claim like that, I think you have to be careful, because to say that works, just ignoring the fact that jobs have just left, like millions of jobs have just completely are gone and just aren't coming back. And
the poor have become poorer, definitely the richer have, of course, benefited, but you just say that's good for our entire country. But with that, let's pivot to the political ramifications of.
Hey, can I just point something out? You said that after the bill, like President Obama will start focusing on job creation, but I think this bill actually will not help the unemployment rate at all, and because so many big companies are getting hurt by this bill, like AT&T, $1 billion loss, that they're not going to start hiring more people because they have to also provide them with health care or like get penalized if they don't. So it doesn't really help the economy right now. I mean, I think the bill has like good points, but it's just the timing of it isn't that great, even though people are going to get taxed later on. It's just the timing of it now. And even Tim said that how are people going to view America, that we're already in a bad state of economy, but then also in the future we're still going to keep getting taxed. Like, how are people going to view this country?
With that, let's pivot to the political ramifications of the bill for both the Democrats and the Republicans. Just looking at polling, a recent USA Today Gallup poll indicated a pretty big shift in support for the bill. Something like 49% of Americans now support the bill, or only 40% oppose it. Those numbers are, of course, disparate, depending on whether or not you're a Republican or a Democrat.
I think the polls on health care don't actually matter as much now as people think they do, because the bill has passed. And another poll taken by CBS and the New York Times last month says that 52% of people still cite the economy as the most important issue, while only 13% cite that healthcare is the most important issue. So now that the healthcare bill is passed, I'm guessing that number will drop because it's just not the sort of legislation that politicians will be talking about anymore, except for people on actually both sides will be talking about them, but running into the 2010 elections, it will still be the unemployment number that will be more important than any poll number out there.
And I think when you mentioned, I think you said like a Gallup poll. I mean, I read an article today that was a Washington Post article, and they had a poll where they said that only 46% of Americans, I think it's 46, 47%, actually support the new legislation, and actually 50% oppose. It says something about like a quarter of Americans actually contacted their elected representatives to find out, or just to, in response to this bill, essentially, and that 2/3 of those people were against the bill. That they were angry about it. And so I think
I think there's a lot to say about the role of Fox News and the Republican establishment.
Well, I think it just goes to show that like people are concerned about this. Like, I mean, from a purely political standpoint, I think would be fair to say Obama has just not really done a very good job of marketing this health care plan to the American people. I mean, people are just really concerned about it, and when you're overhauling such a big portion of our GDP, people would like to know what's actually going to happen, and it.
Do you mind if I break in?
Sure.
On this, just regarding Obama's selling of this bill, I would agree that him and the Democrats did a pretty dismal job selling the bill. I mean, Democrats always have an issue labeling things simply and putting a tagline on it. I would say it's because they're interested in actually explaining what's going on, instead of just like practicing demagoguery.
Intellectuals,
I would say. But I think now, polls show that when individual aspects of the bill, I think we referenced this earlier, when they're highlighted to people, when they tell them that the donut hole will be closed and pre-existing conditions will be covered by insurance, and actually, interestingly enough, when they know that couples making more than $1 million will be taxed, the support for the bill jumps up. And when they realize that all this is in the bill, they go, "Oh, we like this." So, I mean, I think.
But again, that goes back to the whole aspect of, okay, well, if you say to someone, "Well, here, do you want this new service?" They say, "Yeah, sure, I'll take the new service, but at what cost?" And if you tell the person it costs, $940 billion, they might say, "Whoa, nice service, but at this cost, I'm not sure if that's the best deal that I can make."
Well, I think to take Medicare as an analogy, most people, or the elderly, they probably realize that it's bankrupting the country. Medicare is going off the rails right now. We have to do something to rein in spending on Medicare. Yet the Republicans were willing to exploit their fear of cutting services through Medicare to pit them against this bill. I think people, in the end, this is a very broad issue, or a very complicated issue to deal with. I think people are going to latch on to very specific benefits or, negative aspects of this bill and decide whether or not they support it. I think in the end, cost, as has been happening with Medicare, is going to fade into the background eventually, as people realize that we're getting pretty substantial benefits from this bill. I think Obama and the Democrats, as they already have begun to do, will exploit these benefits pretty well to their advantage, hopefully.
Yeah, I mean, clearly basing public opinion on polls alone is not a very coherent way to look at this. I think it can be a good indicator, but when it comes to this bill, I don't think you're going to get very far doing that. I think better indicator would be